Okay, so I'm going to check the patient's chart, verify the order. So my order is for Miss Richardson. She is 44 years old, status post MVA, craniotomy. She is intubated and on mechanical ventilation. Her ET tube size is a 7. Breath sounds are rhonchi. Patient is ordered to be suctioned PRN and she needs to be changed to inline suctioning. Perform oral and inline suctioning. What size is the catheter? So since her ET tube is a 7, I'm going to do 7 times 2, which is 14, and drop down next to the even number, and it comes out to 12. So her suction catheter line is a 12. So I'm going to wash my hands. Wash my hands, get my rolled that in real good. And then I'm going to apply my gloves. Once I have my gloves applied, I'm going to gather my equipment, which would be a saline bullet, my Ballard corrugated tubing, my Yankauer, stethoscope, pulse ox, and my ambu bag. Once I have all of that, I'm going to walk into the patient's room. Hello, Mrs. Richardson and family. My name is Taylor. I am going to be the respiratory therapist for today, and we are going to be changing Mrs. Richardson to inline suctioning. She may become hypoxemic, but we'll make sure we take care of that by pre-oxygenating her. And the reason we're changing her from inline suctioning is because breaking the circuit every time can be a risk of infection, and this will lower her risk of infection. Once I've done that, I'm going to check Mrs. Richardson's 2 patient identifiers. So I'm going to make sure that her wristband matches what I have on my chart, and it does. So I'm going to put the pulse ox on the patient and
clear the secretions.
Listen to breath sounds in 6 places.
And then take this off and keep this over here and attach the inline so it is ready to go for the next
And once
time.
I have done that, I'm going to go ahead and take my bag mask ventilation, set this up for backup in case something happens to this later.
And I'm going to ventilate the patient for 60 seconds after suctioning is done.
I'm going to set this to the side just so the breath needed. Once I've done that, I'm going to go ahead and turn my suction on to -120 between 150, turn that on, and then I'm going to go ahead and pre-oxygenate my patient so I can set them up with their Ballard and the corrugated tubing with my Yankauer. So I'm going to pre-oxygenate for 30 to 60 seconds. Once that's over, I'm going to go ahead and hook up my
turn the suction off. Wash my hands and turn it.
1 second, please.
Perfect. Wait, did you do?
Okay, so once I have that set up, I'm going to pre-oxygenate my patient again, wait 30 to 60 seconds, and then I'm going to go ahead and I'm going to hook up my suction, and then I'm going to go down the tube. I'm going to do this maneuver for 30 seconds, and once I come out, I'm going to press the button to apply negative pressure. I'm going to do this 2 times. Alright, and once I finish that, I'm going to oxygenate my patient again, wait a few seconds, unhook my suction from the Ballard, hook it up to my Yankauer, and suction on the patient's cheeks, around their teeth. And yeah, once I do that, I'm then going to, I have my pulse ox on my patient the whole time to make sure they did not become hypoxemic, which they didn't. They did very well throughout the whole procedure, but I'm just going to redo the heart rate, the respiratory rate, check breath sounds. Alright, and once I've done that, I'm going to take the pulse ox off the patient, and we're going to leave the Yankauer underneath the patient's pillow. Keep the suction back up in case the next respiratory therapist comes in and they need to be suctioned. I'm going to turn off my bag mask ventilation, but leave my ambu bag in the room in case someone does come to suction them again. I'm going to make sure that the patient is good. All of his stats on the machine are the same as whenever I came in. I'm going to clean up all of my equipment, take it out with me. I have my pulse ox, my stethoscope, my pulse ox with me, and I'm going to take my gloves off.
Verify the order.
Wash my hands again. Once I wash my hands again, I'm going to chart the amount of sputum that I got from the patient, the color, the thickness of it, and how the patient did throughout the procedure. And yeah.